My name is Jill Compton, born and raised in Boston. I have 4 sons and 2 daughters, married to my wonderful best friend, Kirk.
Kirk Compton, born and bred in Boston. It's been an amazing ride, quite a roller coaster getting all our kids through high school and off into their lives. It's been a really exciting journey.
I am a school social worker in an urban setting, which is pretty stressful, but it's rewarding.
She is beautiful inside and out. Funny story about the first time we met, we had dinner together. And we're in the middle of dinner, I look up and she's got her reading glasses on, trying to read the menu. She's got her sunglasses on top of her head. So it's been always kind of a running joke for us that she's got like 5 eyes, but always protecting those beautiful blues.
So I had my annual mammogram in December of 2024, and there was something that they actually saw concerning on both sides, my right and my left. My mother was diagnosed with breast cancer about 6 years ago, so I was concerned. I understood enough that it was a positive diagnosis. I couldn't wait. I needed to tell him right away, so I called him, and
it was an amazing conversation because she's a very strong person, but her comment to me was, "I don't want to die."
Kirk immediately went to, and this is one of the reasons I fell in love with him, he immediately went to making a plan.
You know, had to help her, coach her through what we were going to be doing, how it was going to go, trying to get the plans together. I don't want to lose her, and I'm not going to. We were going to fight hard, we were going to work through this.
We sat the 4 boys down, and I just knew that that was going to be hard for them to hear.
And it's amazing because there's 2 sides to this, right? When we were telling the boys, she broke down, but remained strong. When we told the girls, I broke down.
They explained I had 2 options. One was a mastectomy. If I chose that, that was my choice, or a lumpectomy. However, I knew that there was a 3rd option that they didn't mention. I wasn't really sure what we were going to do, and Kirk and I, we had the doctors there that we were talking to, and then I knew that my mother had seen Dr. Chatterjee, and once I met with Dr. Chatterjee, and he explained the process of oncoplastics, and that I was a candidate for it, I knew right away that's what I wanted to do.
Chatterjee. I am an oncoplastic surgeon. I have the pleasure of taking care of patients with breast cancer and take care of their reconstructive needs. So I do remember my meeting with Jill quite well. I entered the room in the clinic and she was sitting there with family. It was very nice to see that she had a support network that supported her as well, much with her husband next to her. And after speaking with her, I have an idea of what options were the best for her. The 3rd option, which is the one Jill chose, was oncoplastic surgery. It's taking a very large lumpectomy or a partial mastectomy and then doing a breast reduction or a breast lift design. This was all done in one operation using her own tissue, where now she has sensation, but most importantly, she has negative margins. Advanced technologies are extremely important in advanced surgical breast cancer cases like oncoplastic surgery. The Molly device is a wireless technology that guides the surgeon. The Molly marker is a device that replaces the needle that points to the area where the cancer is. With regards to SPY angiography, once the cancer is removed, the SPY allows me to make sure that whatever tissue I've left behind has a good blood supply. So my advice to women watching this is please get your screening mammogram. But if you were to have breast cancer, first of all, understand that most of the times you will survive this. Also understand that you have to be your own advocate. You have to understand the options that you have. And then you have to find a surgeon and a doctor who explains these to you as far as what they are and how each option is pertinent or specific to you.
If I saw a woman in a waiting room and I knew what she was about to hear, first I'd probably give her a hug, and then I would say, you have options. Do more research, talk to people, find out what's out there. I want him to know how thankful I am for me and for my mom I hope that he understands how his compassion was what I needed more than anything. And just thank you.
When a patient does well and they come through with negative margins and they recover and you see them in follow-up, it means everything, because at the end of the day, you become a doctor to take care of patients. I hope she's happy that she met me.